Welcome to Medlive. Today's program is Taking Charge of My Eczema. My name is Dr. Peter Leo, and I'm a clinical assistant professor of dermatology and pediatrics at Northwestern University Feinberg School of Medicine in Chicago. I'm joined by Kafid Drexel-Brown from the Asthma and Allergy Foundation of America, as well as Kylie Williams, a member of the Asthma and Allergy Foundation of America patient support community. Throughout our discussion, Kylie will share her perspective and experience as someone living with eczema. We'd like to hear from you during this program, so please take a moment to ask your questions. Just type them into the box below at any time during the discussion. Please keep in mind that the questions should be general in nature. We're unable to answer questions about your case specifically, but we encourage you to bring those questions to your doctor. In today's program, we're going to provide an overview of eczema and tips to help you manage it, discuss treatment options, and talk about eczema in teens. In this first segment, we will discuss your eczema and you. Let's start off with a poll. What concerns you the most about eczema? I'm going to read through all the choices now for us. A, its effect on my ability to perform at work or my child's ability to concentrate/focus on their schoolwork. B, its physical effects, including itching and ability to sleep. C, its effect on my or my child's appearance and how some people react to it. Or D, its effect on my feelings, depression, anxiety, helplessness. Kylie, maybe you could talk to us a little bit about your thoughts on this?
Yeah, so for me personally, I've had eczema since infancy. So I've kind of experienced all of these options. But I would say what affects me the most, which like day to day and for as long as I can remember, is probably B, the ability to sleep and the itching and kind of like the burning I get sometimes. That probably is my biggest concern because sometimes it feels like it will never end or never go away. So I do find that to be like the most concerning. But some of these other options too, it just kind of depends on, what's going on in my life at that particular time. So like, for example, C is the physical appearance. So some of these things can, it's mix and match sometimes on what affects me the most, but B overall for me.
Well, thank you. And it does seem like most of our audience also agreed with you that B, its physical effects, itching and ability of sleep really were of the highest concern, the utmost concern for people. So let's jump right in a little bit. Let's talk about what is eczema. This is a little bit of a slippery term. It's a chronic, long-lasting condition. That's the kind of concept of chronic, but it doesn't mean it's always bad. It can also have these waxing and waning features, but it makes the skin red and itchy. It's often referred to as atopic dermatitis, and atopic just means a tendency towards allergies, where dermatitis just means inflammation of the skin. And we kind of think of eczema as a little bit of a broader term that includes atopic dermatitis, but we often use them synonymously. Generally, it starts before 5 years of age, but it truly can start at any age in life. I even have older adults who develop it for the first time. But typically, we see most cases under 5 years, and it may improve or go away as kids get older. And in fact, that's a great ending if it just disappears or gets way better, but not always. For some patients, it really does continue into adulthood, which can be really stressful. What are the symptoms? Well, we already talked about that itch, and that tends to be one of the most important symptoms for this condition. In fact, probably if it's not itchy, it isn't eczema. It really should be itchy. That's what we're really seeing in almost everybody. The dry skin also tends to follow it as well. It often is dry and flaky and sometimes even cracked and fissured. It tends to appear in characteristic areas on the body. So a lot of places, babies often have it on the face, but behind the elbows and knees, sort of the crook of the elbows and knees is a very common place as well. Hands and feet as well can be involved. But the truth is, it can be anywhere. And I have some patients who their whole body is covered in eczema. We know that there's a bit of a cycle with this condition. The itching causes scratching and rubbing. And of course, that contributes to the damage of the skin. When we scratch or rub or anything like that, that can enhance the redness, bring out swelling, cracking. It can even become open and oozy where it will weep a clear fluid. Then, of course, in the more chronic patients, it becomes thickened, and we call that lichenification, where the skin is really thick. Many patients also have infection, and that can sometimes show crusting of the skin. Now, we think about eczema as affecting everybody, and it really does. It can affect all skin tones, but it might not always look the same depending on the background of skin. So in lighter skin, sometimes it's easier to see redness against fairer skin complexion. But as skin becomes a little bit darker, when there's more melanin in the skin, sometimes it's harder to see that redness. In fact, it looks a little bit more purplish, sometimes more gray and brown. So it can be a little more subtle, and we have to make sure we're paying extra attention in our patients who are a little bit darker, because sometimes at first glance you can overlook its severity, and we do see that. It's easier to look and say, oh, it doesn't look so bad, until you go very close and you say, oh, wait, actually, it is pretty bad. It's just a little bit less dramatic than in really very, very fair skin. We know that in darker skin patients, there often are slightly different types of eczema that we'll see. And again, these can affect anybody. It's just maybe a little bit more common in some folks than others. And what we'll often see are tiny little bumps. We often refer to this as follicular eczema, and they can be on the belly, they can be on the arms and legs, but that pattern is a little more common in darker skin tones. Dryness and dark circles around the eyes, we see again more commonly in darker skin types. And then we'll often see some of these thickened areas. Sometimes we'll refer to them as prurigo nodules, or picker's bumps, where it gets thick and more raised. Again, a little bit more common in darker skin types. The other issue is if your skin's a little bit darker at baseline, sometimes when the eczema heals, it actually looks lighter than the surrounding skin. Many times it can go darker, but if the skin is darker to begin with, sometimes we'll see it lighten up a little bit. So the general term for that we use is dyspigmentation. It just means the pigment's not right. You know, sometimes we say it's hyper, it's too much pigment. Other times we say it's hypo, it's too little. But a more inclusive term that we often use is just it's not working right, dyspigmentation. The truth is, though, that treatment is really the same for all types of skin. It's just a matter of being extra aware that it might not look the same across different skin types. What causes atopic dermatitis or eczema, we still don't fully know, and that's been a really interesting adventure as we've learned more and more and more over the years. We do know there is a genetic component to this condition, and that's really important. It often does run in families. So we know that not only do family members more often have eczema, but they often have other allergic conditions like asthma and hay fever, also known as allergic rhinitis. We know for sure that at least one mutation, there's a protein called filaggrin. So the gene that encodes for this protein, when it's not working right, when it's mutated, and that of course can be passed along from generations in a family, that can be a big risk factor for developing eczema. And of course, we know the environment is playing a role as well. Skin irritants, different types of allergies, we know even pollutants, different types of pollution we're exposed to can probably all play a role, but it has been a little bit tricky to put everything together. Now, in the old days, people just felt, oh, it's just a little skin condition. You know, it's just on your skin. Put a little cream on it, you'll be fine. But now we understand this is not just limited to one area of the skin, and not even just limited to the skin itself. It really affects the whole body. We think of this now as a systemic condition, particularly for the more moderate and severe patients. And it's important to think about this because the immune system, of course, runs and courses through our entire body. So if it's overacting, we want to know about this. We want to understand this. So it's important to us because it is chronic, meaning it can go on and on and on for some patients. And we really think about the importance of treating people holistically, thinking about the whole body and not just one little patch of skin. Now I would like to turn things over so that we can talk a little bit about the emotional aspect of eczema and how important this is. Kafi, could you take us through a little bit about this?
Yeah, sure, Dr. Leo. This is a really large component of this and something that we hear about a lot from our community. Are emotions part of your eczema experience? And yes, they definitely are. People say that they experience anxiety, depression, lack of sleep and exhaustion. And that actually goes back to something that we've been discussing and came up toward the beginning of the presentation, with itching really being what people feel is the biggest symptom that they're experiencing and that gives them the most difficulty. In fact, in 2019, AAFA joined with 4 different other organizations and formed a collaborative called More Than Skin Deep, which the aim is to learn more about different medications and research to help with eczema. But in that also a survey was done, and 79% of respondents said that the itch was the most problematic, and that was the top concern of most people. We also have low self-esteem, self-confidence issues, trouble concentrating. Again, that goes back to being distracted with that itch, paranoia in terms of avoiding triggers, social isolation, and relationship issues. Moving along, there are things that you can do to prepare when you go into your doctor's office. We're really big on empowering patients and making sure that you feel like you're have all of the information there to go into the doctor's office. And so you want to think about some of the key questions that your doctor might ask you on one of your first visits about this. And that's what symptoms concern you, where did this start? The medical history is a really big deal as far as this is concerned. And I actually want to bring in Kylie really quickly to find out from you, Kylie, what kind of things your doctors asked you, and if you find that knowing some of these things in advance really help with your visits.
Yeah, so for me at different times, there's might be different doctors, and I love going into the doctor knowing what to kind of expect. So I'm not quite so blindsided, like, as you can say. So if I go to a doctor and they ask me, questions like, well, when do you notice that your eczema is at its worst? Then, you're kind of prepared with those answers. You can start trying to think about those answers before you get there. So instead of it just being sprung on you. So when does my eczema flare the most? Probably when I notice that I'm, washing dishes the most, or, doing more things outside, or, just having those kind of questions prepared. It does help. It really does. Like, I remember being younger and going to see we're going to get into like which doctor you should see, like dermatologist or, your primary care. But I remember going to the specialist doctor and just kind of being overwhelmed, when I was younger, like, well, why are they asking me this? What does that have to do with the eczema? Like, just fix my eczema, but knowing that they're going to ask you these types of questions, it does help. It makes a difference. Definitely.
Wonderful. On the flip of that, there are also questions that you can ask your doctor. What's causing my symptoms? Are there tests that can help us be sure of a diagnosis? Will my eczema go away on its own? Kylie, I'm sure that you've experienced this as well.
Yeah, definitely. And also just knowing that, having that kind of strength walking in, knowing, okay, this is eczema. And once you're diagnosed with it, it's just the best thing you can do is to learn to just take control of it. Like, don't let it take control of your life. So don't be so scared, like going to the doctors and, just trying different things and trying to figure out what's going to work best for you. And, whatever you need to do to just, take that control of it and, make do with the best you can.
Yeah, and taking control is such a big thing, both in the healthcare setting, whether you're seeing your primary care physician, a dermatologist, your allergist, or if you're experiencing things at home. And there are things that you can pay attention to at home as well. What you can do about eczema at home. First, avoid what makes your eczema flare, right? So you want to be aware of some of the irritants and allergens that can make your eczema worse. Irritants include soaps and cleaners, wool or man-made fibers, some perfumes and makeup, chlorine, mineral oil or solvents, sand or dust. Allergens, food allergens like eggs, peanuts, milk, fish, soy products, and wheat. Because, let's keep in mind, this is all connected. There is a connection between asthma, allergy, and eczema. Dust mites, mold, pollen, dog, or cat dander. And when you're also thinking about things inside of your home and in your environment, there are things that you can actually do to also control and improve the quality of your environment. AAFA has a partnership with Allergy Standards where we have certified asthma and allergy-friendly products that people can also consider to put in their homes to protect them from those dust mites, to help eliminate dog or cat dander when you're vacuuming. A lot of people don't realize that when you're vacuuming, often some typical vacuum cleaners will just disperse things into the air, all of that dander. And there are vacuum cleaners that can help control that. So that's what we mean when we talk about a certified asthma and allergy-friendly product. So that's definitely something to look into as well, especially if you want to go to AAFA.org and check that out. Okay, so a few more things to avoid that can lead to flares: long and hot baths and showers, not moisturizing after baths or showers. A key thing is you really want to make sure that you're staying as hydrated and moisturized as possible. You want to be able to make sure that that's happening with your skin. So dry year-round climate can impact you, low humidity in winter, going from sweating to being chilled. That happens to me a lot after my runs, skin infections. Those are also other things to make sure that you're really taking note of. Okay, so other things that you can do for effective management for your skincare. Like I just said before, hydrate. Make sure that you're hydrating. You want to make sure that your baths and showers can help you to remove scales and crust, get rid of microscopic particles rather on the skin. Use warm, not hot water. Hot water can make symptoms worse. Moisturize right after bathing or showering, and repeat that several times during the day. Make sure that some people walk around with different moisturizers to help out. And ask your doctor about bleach baths. And actually, I want to ask Dr. Leo about that as well. Because some people are aware of this, others aren't. Especially now, we want to make sure that people are, using bleach and other products safely throughout the pandemic. So when it comes to bleach baths and eczema, Dr. Leo, how can people most safely and effectively do this?
Yeah, thank you. The bleach bath story is really a strange and interesting one. The first publication about it specifically came out in 2009, and that was Dr. Amy Paller's group along with Dr. Jennifer Huang, and they did a really nice study, and they were able to show that dilute bleach baths. So generally when we talk about this, you'll fill up your bathtub with warm water. You'll take a 1/4 cup to a 1/2 cup of plain old household bleach, and you put that in, mix it really well, and then you step in. So it's a very small amount. When used this way, it's quite safe. The only thing I've seen is sometimes people that have very reactive airways, if they have asthma, sometimes just the smell of that bleach can be a little bit irritating, but it's actually more dilute than a swimming pool. So people say, oh my gosh, bleach, but it's really, if you've been in a swimming pool, that's what they're using. It's a form of chlorine, right? So in this case, it's sodium hypochlorite. The original thought was that bleach baths were antibacterial. That was the thinking. Oh, it might fight some of the bad bacteria on the skin, particularly Staphylococcus aureus, which is playing a role in driving eczema. But it turns out it probably doesn't do much directly against bacteria. It's so dilute. Now that they've done some follow-up studies, they say, boy, the eczema seems to get better, but independently of the bacteria. So now we think that something about the bleach is a little bit anti-itch, a little bit anti-inflammatory, and may also help heal the skin barrier a little faster. So I still do like to use them sometimes, but probably not for the original reason we thought. They probably aren't actually killing the staph bacteria on the skin at this concentration.
Okay, I'm going to ask you a few quick follow-up questions on this, and that is, I'm sure some people might wonder how this does it have any effect on your reproductive health at all, taking a bleach bath? Are there any concerns with that?
Honest to goodness, we don't think so. So if you've ever been in a pool, if you've ever been in a swimming pool in your life, you've already taken a bleach bath. So that's the level we're talking about. So anything, people do home birthing stuff with babies in a pool. People take the little babies, the goldfish classes, where the little tiny 3 and 6 months old are swimming. So all these kinds of things, you've already had a bleach bath. That's how safe they are. So we don't think there are any specific issues with it. Of course, we would never want to use straight bleach on our skin. It's very caustic and very dangerous. We never want to be drinking bleach or taking it in our body that way. But the way we're talking about it here, and it looks like there's a nice link to the bleach bath recipe card from the National Eczema Association, that'd be a great way to sort of ensure that you're doing it correctly. And I do think it's good to work with your doctor on this.
Yeah, and that gives you also information on what level of severity you should consider doing this and how often you should consider doing it as well, right?
Exactly.
Okay. All right, so moving along, there are other things that you can do and other steps that you can take to help. That includes wearing soft clothing, cotton, not wool, keeping temperatures cool, especially at night, using a cool mist humidifier year-round, washing your clothes with mild detergent, no bleach or fabric softener, and avoiding foods that can cause allergies. And Kylie, I want to also find out from you, are there any other steps that you would include that you find particularly helpful controlling eczema?
Yeah, so actually just within the last couple years, so I found where I have eczema in different parts of my body. I have it on my legs, like my thighs sometimes, the back of my knee sometimes, inside of my elbow, actually a little bit of flare up right now. And then the worst of it's on my hands. So my hands just sometimes are just full blown eczema, cracked everywhere, painful. So I actually found the most random thing that I never would have thought of, but they are cotton gloves that they sell at the pharmacy. And when I do have my my ointments, like my medicated ointments, I put that on, or if I'm just have my moisturizer on at that time, I put those cotton gloves on, and that has made a tremendous difference, especially when your eczema is in places that, you need to function. You can't just, stand like a scarecrow all day long, with your eczema. So those are things, and definitely avoiding like the fragrance and the, like the scented lotions. And that's difficult. Now for me, like growing up in high school, like Bath and Body Works was like all the rave, and like the Victoria's Secret, different sprays and body lotions and stuff, and we all wanted to try to find our signature scent, and it was things like that. I remember growing up, like especially as a teenager, I wanted to be a part of it too. Like I wanted to have those things too, but it wasn't worth it, and that's just something that I had to just come to terms with. Like it's not, I can't be for everybody. And this is, how I have to, take charge of my eczema once again is, avoid those things. So those things definitely help. Like just when they say like, or when, you're in a community, like an AAFA or whatever community it is, and you see somebody with eczema say, hey, this has helped me, and you want to try it, like as far as, things to avoid, it's okay to give some of those things up. It makes it worth it in the long run. So yeah. I do that.
Mm-hmm. Okay. Well, I also want to ask Dr. Leo. Actually, no, not your turn yet. Sorry, Dr. Leo. I want to stay with Kylie for a minute, and while we're talking about when it's time for medical treatment, whether or not you should see your primary care physician, a specialist. Usually you want to start with your PCP. They may refer you to an allergist or a dermatologist. That's really key. Once again, all of these things are connected. You may want to ask about seeing an allergist and a dermatologist as well, rather than just waiting for that referral. And like it says here, always the choice is yours. Consider access, insurance, and cost, whether you're covered or, what this might cost you out of pocket, and satisfaction with your referral treatment. And Kylie, I would also ask of you, what's your experience been like that as well? If you can remember what that was like when you first went to see a doctor about this.
Yeah, so for me, it was kind of just, I wanted that quick fix. So it's hard when you have eczema and you might not know it's eczema yet, and you just have something that's, like a patch and it's just itchy, won't go away. And then you're finally able to go to a doctor and, maybe the first couple times they give you something to try and it might not be for eczema. And just having that, resilience to keep going back, be like, it's not getting better. Like, make sure you do that, because I remember I've had eczema since I was a baby. So it's kind of different for me. I never just woke up with a random thing on me, not knowing what it was. But I can imagine how kind of frustrating that would be, just not knowing what it is. So just getting to the doctor, and then if something's not working, speak up for yourself. If you have tell your parents, I really want to try something else. Can we see if my doctor will, refer me to a dermatologist or allergist, or just find out what I'm doing that's making this worse. So, I definitely remember doing that. I definitely remember once I finally had a dermatologist that I was comfortable with, just building that relationship with them, so that you're never afraid to, talk about, things that, might make you insecure, or their intimate things or anything like that. Just, having that, being comfortable with them and asking all the questions in the world you need to ask. So.
Thank you. That's really good feedback and really good advice that I'm sure is going to help a lot of people when they're going in to see the doctor. And now, Dr. Leo, I'm going to turn it over to you for some live Q&A and to take some questions from our audience.
Awesome. Thank you. So a couple of questions that have come in, and feel free to add more right into the presenter, the little chat box. We'll see it come up for us. So one question is, what is the role of food allergies in atopic dermatitis? And this is really an important question and comes up a lot. In fact, many of the families coming to see me want to talk mostly about food and food allergy, and they are intimately related. So we know that patients with atopic dermatitis or eczema have a much higher rate of food allergy. And it turns out that the worse your skin is, the more severe the eczema is, the higher likelihood that you have food allergies. And in fact, the number of food allergies is also correlated with that disease severity. So historically, people thought, well, maybe stuff we're eating is triggering the skin. And that certainly can happen for some people. But now we've kind of turned the narrative around. We actually think that it might be, for a lot of people, the opposite, that when our skin barrier is damaged, broken, oozing, weepy, I often call it leaky skin. So that dry skin or oozing skin is a sign that the skin barrier is not doing its job. When the skin barrier is not doing its job, allergens and irritants from the environment can get into our body in an abnormal way. And we think that is at least one mechanism whereby people become sensitized to foods or allergic to foods. So now there's a push to feed kids. So we know about, for example, the peanut studies. And in fact, this big study was called the LEAP trial. And the LEAP trial looked at and said, boy, in Israel, there's almost no peanut allergy. But in the United States, and the UK, there's all this peanut allergy. Why could this be? And the idea was that maybe it's because in Israel, they have some kids' snacks that have peanuts. They're made with peanuts. So they give little babies who are teething peanuts. And when they did this study, they found, indeed, if you give kids peanuts early on, then they become tolerant to them. They don't develop allergy as much as if you hold off on them. But the mechanism is really thought to be through the skin that they get allergic, at least again for some patients. So that's kind of the connection. But there's no doubt some people seem to have certain foods that make them flare up, but a lot of patients don't. I have so many families who have been so frustrated. They've been searching and searching and searching for a food or foods, and they're like, gosh, we can't find it. Certainly they have true food allergies, that can cause urticaria, hives, or anaphylaxis, really dangerous. I know they're not cheating on those. It's not like they're trying to sneak a peanut or sneak an egg if they actually have allergy to egg. But they're looking for other foods that are inflammatory, and it often is very, very stressful. The other good thing about food and eczema is I find that, again, outside of the true known allergens that will give you hives or angioedema or anaphylaxis, the ones that are causing more just maybe a skin flare-up or just seem to make inflammation worse in the body, I often find that those are more of a threshold issue. If we get the skin better using our traditional treatments, our conventional treatments, many of my patients say, you know what, we were pretty convinced that like tomatoes were making things worse, or gluten was making things worse, or dairy in general was making things worse. And those are three foods that are often implicated as being kind of inflammatory. But I've had many patients say, but now I'm okay. My skin's a bit better and I'm actually able to have some pizza and it's fine. So that's wonderful when that happens. Other patients are able to find certain foods that trigger it. Now, the most common allergens we see in general, the true allergens that you can find on either a skin prick test or a blood test, are milk, eggs, wheat, fish, and nuts. Those are kind of the 5 biggies. There are many others too, but those are the ones that we kind of look at in general. Another question that came up, first, are there any other, did anyone else, Kafi or Kylie, did you want to add anything about that? Because I know food is such a big part of the journey for a lot of people.
Kylie?
No, I actually do have food allergies. So I have some foods that I am anaphylactic to, so I avoid completely. And just keep in mind that everybody's eczema is different. So everybody, like no two people have the same exact eczema. So that's kind of a challenging part of it as well. So with my food allergies, I never noticed my flare up in my eczema when I, accidentally eat something that I'm allergic to, or, there's cross contamination or anything like that. But I will tell you, when my eczema has been really bad, I do try to see, like, I'll switch up my diet more or less. I don't want to call it a diet, but I'll switch up the foods that I'm eating. So if I notice, like, I've been on like these protein bars for, a few weeks and my eczema is bad, I'll get rid of that and try something different just in case. Cause you really never, it's really hard to really tell because it's hard to track like every single thing you eat and correlate that to what your eczema is doing at the same time. So I would just say, just try different things when it comes to the food. Mm-hmm.
All right. That is wonderful. Thank you so much. I think we're going to move forward just in interest of time. And we'll have time to do more questions later. And we are going to go into session 2. How do I know that my medication for eczema is working? So again, let's begin with a poll. And we'll start with these questions. And I'm going to read everything. The question is, what are you using to treat your eczema? A, home methods like baths and moisturizing. B, topical treatments like steroid creams. C, oral steroids. Or D, newer treatments like targeted biologics. And again, Kylie, can you tell us a little bit about, I'll bet you've probably tried all of these things at various points or many of them.
Yeah, definitely close to it. This is another one of those things where it can be multiple answers. I would say A for just the home methods and well, A and B. B because, you get to try new methods of ointments and new different lotions and moisturizers. So that's what I do the most. Now, A is important too for me personally too. The soaking and just keeping the parts on my body moisturized that do have that eczema. That's where I see like the biggest difference. Again, it's, it's a time commitment and sometimes it does kind of take you away from your day to day when you have to, you're trying to walk around with, ointment and whatnot. But again, some of these are going to be, multiple answers, but for me, probably A, B.
And I think that makes sense. That's a wonderful way to put it. In looking at the poll results, B was the top choice, so topical treatments like steroid creams, and A was a kind of a second place, home methods like bathing and moisturizing. But I agree. Ideally, we're doing, multiple of these or even all of these at certain points. I was happy to see none of C was on the poll, though, and that's good because we really try to avoid oral steroids, oral corticosteroids, as much as we can. Those are not such a great option for many patients, so I'm really glad that one wasn't represented. But the other things like moisturizing and bathing and maybe using some topical creams, I'd hope most people have used or are using. And then the newer treatments, I think for the more moderate and severe patients can be really helpful. And that's one of the hardest things. One of the things that maybe people don't know about me is that I'm focused on integrative medicine and I'm also an acupuncturist. So I am really interested in not using medicines unless we have to. So I try to avoid it, but I'm also interested in getting my patients better. And sometimes it's disappointing for patients that I say, you know, I think we need a medication. And they say, but wait, don't you do other things? And I say, yes, but as this slide really tells us, medication is unfortunately often necessary, especially for the patients who are struggling enough and suffering enough to come see somebody. There's lots of really mild eczema out in the world, I think, with just sort of sensitive skin, delicate skin that probably never need to see a doctor at all. They're comfortable. They can use gentle therapies. But as it gets more severe, many people need to do it, even if you're doing everything correctly. So I think it's so important to talk about what you're able to do, what you're willing to do. And I want to make that decision comfortably. And I offer it as, hey, this is my experience. This is what I think will help you. This is what I think is the best risk-benefit approach given where you're at right now. And I think that's what's so important. You are the expert on you, and you have to be comfortable, because the truth is, I could tell you all sorts of stuff, but if you're not going to do them, it's not going to help. Right? It's not going to help anybody. In fact, it's sometimes a wasteful thing. You know, people will fill a prescription but say, you know what, I'm not comfortable. And now we've all sort of lost. So I think it's so good to have that therapeutic alliance, we call it, where we're working together, where really your best interest is at heart. And we want to find something that is safe and effective and comfortable for you to use. So we know there are lots of different options out there currently. The mainstay, I would say, are topical steroids. There are tons of topical steroids out there. I think it's useful just to think of them as a class. You know, some are greasier, some are creamier, some are stronger, some are milder, but generally these are great because they're very effective. They work almost in everybody. They work really quickly too. And then they're generally very affordable. So almost everyone can get them. The problems, of course, are that we don't want to use them all the time. We don't want to overuse them. They have their own set of safety issues, so we have to be careful. And some patients prefer not to use them at all if possible because of different concerns or if they've had a bad experience in the past. So fortunately, they're not the only treatment, even though that's often where we'll start. The next thing is we have what we call our non-steroidal in anti-inflammatory medicines, or our non-steroid creams. And these include the calcineurin inhibitors. And their two names are tacrolimus and pimecrolimus. And then we have a newer one called, it's a topical phosphodiesterase 4 inhibitor, and it's called crisaborole. So those are out there as non-steroidals, and they're safer in some ways. And the trade-off is that they're in general a little bit less effective than steroids, and they tend to be much more expensive. So it's like these little trade-offs every day we have to make them. We also have certain antibacterial creams that we can use in certain cases. Then we did mention the oral steroids, which we try to avoid, but can be really lifesavers in a pinch. We have light therapy that we have patients do sometimes, which is really powerful. And then we have, just starting in 2017, with each year we've had some new ages, we have our first biologic agent, which is really nice. We can do a shot that targets just the inflammation around eczema and seems to help a lot of those patients. So we finally have some options. But what's really exciting is we also have a lot of options now in the pipeline. Finally, we actually have people interested in it, studying it. So that makes me really excited that in the next few months and few years, we're going to have lots of options. But the one I had mentioned, the first new big agent, came out initially in 2017. It was approved for adults, but then just this year they kind of approved it down to 6-year-olds and up. So now we kind of have it in some of the younger children, which is great. And this is the one called dupilumab. Its trade name is Dupixent. You may have heard it as that. It's a shot. Generally, it's given every 2 weeks. And the littlest kids, the lightest weight kids, the dosing's a little bit different. It turns out it's a monthly dose schedule for those kids. But for most people, most adolescents and adults, it's every 2 weeks. But it is a shot. And it's exciting because for those more moderate and severe patients, this is not for everybody. It's not for the mild cases that are doing well. But for those who are struggling and not doing well or overusing their medicines, like their topical steroids, it can really be a life changer. And I will say, while it's not perfect, for sure, it has its own issues. A lot of my patients are so grateful for it. And I've never gotten more hugs and fruit baskets and thank you notes since this medicine. And I say, it wasn't me. I'm just grateful that we have this option. I'm so glad it's helping you. So when we talk about moderate and severe and mild, what do we mean? And of course, it is a little bit slippery because everybody who has it knows that sometimes it can change within a day. You can wake up feeling pretty good, and by the end of the day, things are miserable. So how do we figure out how bad somebody's skin is? And the truth is, it's very imperfect. We don't have a great way to do it. But one way we can do it is simply by looking at the skin And there are different scales. This is an example here. I really like this image. This was, it's part of a tool called the PO, or Patient-Oriented SCORAD. And what this is something that families can actually do, patient can do themselves at home. And it's designed really for research, but I have had families print it out. It's a free thing. You can get it on the internet. They brought it in and say, here's my PO SCORAD. And I will have families do this or a version of this to actually help me. But this gives a really nice illustration of what it looks like. Here's a baby's face that's a little more mild. Here's moderate, and here's severe. And when we see these, this can kind of help us calibrate with each other so that we can say, okay, we kind of know what we're talking about when we say moderate or severe. And it's interesting because depending on your life experience, you might view this as, you know, maybe if you're really, really bad, you look at the severe image and say, oh, that's me on a moderate day. So it's kind of interesting that we want to be all on the same page with it. This is what the PO SCORAD looks like. There are some questions. You can fill in the body areas that are affected. It also does ask some questions about the intensity of itch and trouble sleeping, which makes it really powerful. It's one of my favorite tools to ask. And though, again, I don't do it formally for most patients, unless I'm in a study, I do use a lot of the same ideas from here, and it's really powerful. There are other things that we can do to also assess it. There's a thing called the EASY score, and that stands for the Eczema Area and Severity Index. Again, that's mostly done in research. It's really hard to do just day to day, but it's great for research where we kind of split the body into 4 areas and look at these different aspects and give it a number. And it actually ends up being a pretty reliable indicator. But my favorite of all is the one on the left side of the screen, the POEM score, the Patient-Oriented Eczema Measure. And this is great. It's just 7 quick questions. You can zip through them. And I am getting more and more interested in having all of my patients do this. I've been thinking maybe I'll have everybody do it because it asks questions about itch and sleep disturbance. It asks about skin bleeding, weeping, or oozing. And it really has been studied and validated in a way that we know patients can do it. They can give us a really good sense of where they're at, and we can measure change over time. So really, really nice thing. Quick and easy, not too onerous to do 7 quick questions. I love it. So let's move on to another question, another poll question. And this one is, what does treatment success mean to you? A, feeling normal, quote unquote. B, clear skin and no more itching. C, sleeping through the night. Or D, being social, not feeling like I have to avoid people. And again, Kylie, can I call upon you to give us some of your thoughts while people are putting in their thoughts and their answers?
Yeah, absolutely. So I think it's kind of hard to define for me personally, but definitely C, when my eczema is kind of under control and at nighttime, I just, feel good and I just know I'm going to get a good night's sleep and I'm not going to be up itching and, or rubbing or anything like that. Then I'm like, okay, treatment's working. Like it's happening. It's doing better. Definitely B as well, being able to, see the areas of my skin that are mostly affected, like not be scaly and, or dry and stuff like that. So just seeing that, the skin is clear for that moment, that really that means success. I'm like, okay, this is working. And just, just that feel of, okay, my eczema is under control as much as I can have it under control right now. So for me, yeah.
Perfect. Thank you, Kylie. I appreciate it. So it looks like most people answered B, the clear skin and no more itching, which I think is great. So that I think is the goal for sure. Although again, I agree. All of these really are the goal. If we're doing a great job, then it should be A through D. Mm-hmm. Okay, now I'm going to turn it over and we're going to talk about having the conversation.
Yeah, so this part is very important, especially this first point that we have here is that it's different. So just real quick, my sister is only 17 months older than me, and we both have had eczema since birth, and her eczema is very different than mine. And sometimes that's frustrating because things will work for me that won't work for her and vice versa. So, and placement of eczema is different for us too. So she always had her worst eczema kind of, inside of her elbows here to take up that space. And mine's been on my hands. So, just knowing for me, she can wear a long sleeve shirt to cover hers, but my hands are here, so stuff like that is tough, but have the conversation so that you can have control and your eczema doesn't control you. So like just going to the doctor, some people might not, want like a full clear up, or it's not like as harmful for them, or it doesn't affect their day to day, so they don't pursue it as aggressively. But for me, I needed my doctor to know that I want this, treated quickly, as quick as possible. I have things to do. I'm active. I want to, get to those parts of life. So knowing what your doctor knows what you want is very important. And then what you're going to tell your doctor about your eczema. So don't, they are going to ask you questions. They have to ask you questions. Like Dr. Leo was showing you those different checklists and like, survey type things. Like those are important, but you should be speaking too. So, take control of that conversation. So tell your doctor, like, don't be embarrassed. Don't be ashamed. Don't be like fearful to tell them, things that you go through, or especially how you're feeling. Like for me, especially high school as a teen, it was just, it was almost like a social embarrassment. People would think that I was contagious when my eczema was flared up, and they would like kind of like, steer clear from me. And that was hard. Like that's harmful. And just, don't be afraid to express those things. Things that might be, a little embarrassing that you want to, think that your doctor wants to hear. So for example, I know Dr. Leo is not going to want to hear this, but sometimes my eczema is so itchy that I find myself like kind of biting my hands, and that happens to us. Just, like this is a community where, you have eczema, I have eczema, that puts us in a community. So ask and, doing those things. And honestly, like I mentioned before, eliminating things that make your symptoms worse, as hard as it might be. Like we talked about food allergies. If you love milk and you're drinking milk, but you notice that your skin flares up, it's something that you might have to cut out. But I promise it's worth it. Like it really is worth it to cut some of those things out. And then like also what you're willing to do. So that's important, because for me, for example, I'm willing to coat my hands, cover them with gloves, and just, kind of sit like a scarecrow for a while. And I'm willing to do that. So knowing, what you're willing to do really helps your doctor to get you on the best treatment plan for you. So that part. And then also just getting ready for the appointment. We touched on this a little bit earlier, but just know that there's different treatments for different people. So it's not like you don't go to one eczema doctor and they're like, here, this will fix you. Like it doesn't work like that. So just before you go to the appointment, know what you're walking into, so that you walk out of there happy, basically. Because I remember sometimes even being younger and thinking to myself like, oh, this isn't going to help, So you really want to walk out of there happy and like knowing you're going to, try something and it's either going to work or you're going to try something else. So just know that, like, that's a big part of it. Medications or, anything you do or take, vitamins, even like daily vitamins, like just tell your doctor, like being honest with your doctor, I promise, is so important, because they really can help you narrow down what's going to like be the best for your eczema. So just knowing, being honest, and just preparing, like that's a big part of it. So there's more options here on this slide, as you can see, getting ready and just like telling them what you've tried. So sometimes you try different moisturizers that are just over the counter, like let them know those different lotions that you're trying and how often you do it. And, just again, being honest, things you do, like if you go swimming all the time, or if you work at a job where I worked at a job where I washed dishes. So I was a dishwasher. So my hands were constantly there. Or I was at another job where I wore gloves, like latex gloves. And so knowing that that's important to, disclose to your doctor, it helps a lot. It really does. So we're going to, get back to Dr. Leo about these different treatments, like what will work for you specifically.
Perfect. And that's a perfect introduction, because it really does vary from patient to patient. And a big part of our job is trying to find the best fit for a patient. So the one that you can actually do or feel comfortable doing is really going to be super important. And that's why we have to work together to figure out, what have you tried? What are you interested in trying? And looking at your overall health and your state of your skin, that's going to really help us build that plan together. I think one of the things I find for a lot of my patients is that we end up going back to some things that they had used before but in a new context. So sometimes people say, well, I've already tried that and it didn't work. But I'll often say, you know, we're going to try to put this as part of a more holistic plan. And in that context, I've had many patients over the years say, boy, that you're right. It didn't help me with the way we were using it before, but in this new way, it's helping me. And what do I mean by that? I don't want to sound too cryptic, but I try to build a plan that at least has two phases. What to do when things are flaring up. So we kind of have a rescue plan that we can use for a few days, sometimes a week, sometimes even 2 weeks in more severe situations. But I generally am trying to use the stronger medications for just 3 to 5 days. Once people are better, then I have that secondary plan of more maintenance. Ideally, we're going to try to stay non-cortisones or very mild cortisones at most, but ideally non-cortisones. And we have all of those kind of things to strengthen the skin, to help the microbiome, to improve the barrier, all of these things, and keep inflammation down. And when they're in that context, we often find that people need less and less and less time in that flaring up or rescue state. And that's really another way that I know we're doing a good job. So we have some question and answer time now again. Let's talk about a couple of questions here. One came up right now is that about hand washing. What can we do in terms of our hand washing because we're washing our hands so much due to the pandemic? And I'll say that this is a very tough situation because everyone really does need to use good hand cleanliness and soaps. And of course, a lot of people are using hand sanitizers, which ideally should have alcohol if they're going to actually, if we know they're going to kill the virus, but that's really brutal on our hands. So I think the best things are, if we can, as much as we can, using gentle cleansers. So non-soap cleansers, what we call synthetic detergents that are really mild. I personally am kind of obsessed with the oil-based cleansers. There's a number of different brands that make oil-based. They're very, very nice. We still think they have the ability. They still have a soapy effect. So I think they still are fine killing virus and cleaning our hands, but they're much gentler. And then no matter what soap you're using or cleanser you're using, right after, if you can pat dry and put on a good moisturizer, that's going to help really seal things and keep the hands in good shape. So we're going to keep moving because we're getting a little bit low on time. So I'm going to move to section 3. I'm 15 years old and I've had eczema for years. Is there anything I can do? So adolescents with eczema is a really tough group because, again, we said most of the patients really get it when they're a kid under age 5, but we do have teens who get it in the first time there or continue to keep it through their childhood into teenage years. And of course, being a teenager is tough for its own reasons. So many changes going on. It's a tough time in general. To add eczema really makes it super tough. But there is good news. We really can get our teenagers better with bad eczema. So let's do a poll real quick. Besides symptoms, what is the hardest part of having eczema as a teen? Is it A, low self-esteem and lack of confidence? B, feeling like other people avoid me because they think I'm contagious? C, fearing that I'll never be able to have a boyfriend or girlfriend? Or D, hating being different from everyone else? And then Kylie, could you tell us your experience as a teen? Because we know you've had it for a long time.
Yeah, when I was a teen, it was probably one of the worst times of my eczema, and for my sister as well. Like, that was one of the worst times that in our lives that we've had our eczema, like, that flared the most it was. So A and B. So being a teen and just trying to explain to like your peers that this isn't contagious, like you're not going to get this just if you're around me. Like, that's a hard thing to have to do as a teenager. Like, you want your friends to know, like, you can still link arms with your friends and things like that. So that part was really tough, because you're not a doctor, so you can't really explain in detail what eczema is. So just like letting them know, like, yeah, it's flaky and dry, but it's not contagious. Like, that was always a difficult conversation for me to have, like with my friends or, whoever would ask questions. Like, that was tough. So yeah.
Fantastic. Well, the majority agreed with you. Kind of A and B were the top choices there. So low self-esteem and lack of confidence and feeling other people avoid me. And I agree, all of these can be tough. And the truth is, it's not just for teenagers either. It can be in any age group, but I think our teens carry a real brunt of the burden here. Now, Kathy, could you tell us a little bit about some connection between emotions and eczema here?
Yeah, so we've talked about this a lot throughout and even just now. And you see some of the common things with teens that they might feel and that they've shared with us, feeling having eczema, and that's anger, depression, feeling anxious, sometimes embarrassed, sometimes feeling isolated from peers. And obviously it's disruptive for learning because of the itching. And, you know, really worst of all, sometimes feeling suicidal. And if you're ever experiencing that, please do what you can to contact a healthcare professional and to reach out and to just make sure that someone knows that you're talking to people about this, especially a healthcare professional, to get you help that you need. Because in that situation, it's obviously not just the eczema. The eczema might be compounding things, but we want to really make sure that people get help. I'm going to kind of speed through this a little bit. You can, you know, we talked about, you know, different things you can do between talking to people and support groups, et cetera, but we are limited on time, and I hate to rush through this last bit, but we have a bit more to get through. And I want to talk about myths and facts really quickly. I'm going to go over a couple of them with Dr. Leo. First one is a myth, and if you can bust this myth for me, Dr. Leo, that everyone outgrows eczema in their teens. What's the skinny on that?
Yeah, they really don't. And a lot of patients are really upset that they were told they would. It's like, don't worry, you'll grow out of it. But they definitely don't. It can persist all the way through adulthood. So I try never to poo-poo it that way.
Okay. And I want to make sure that we get through this, but people take a look at some of these myths. Hopefully you're able to skim through it if you're looking at this at home. Other myths: eczema is caused by allergies to dairy and gluten in teens. For dry skin, lotions work as well as thick creams. If soap doesn't lather, it doesn't clean, and then it'll smell. I can attest that that is not true. I make sure that I use lather-free soap myself, and I smell pretty good. Any facial moisturizer, makeup, or sunscreen will worsen eczema. So definitely take note of those. I'm going to move on. We've been through some of these as well. Questions your doctor might ask. Here are a few more. What are your triggers? What type of soap have you been using? All of these things can help to get down to the bottom of things and help you to improve your outcome. Okay, what triggers eczema in teens? This is really important. Dry skin, irritants. We listed some of those beforehand. Stress, heat, and hormones, especially in females. And a gentle skincare program for teens with eczema. These are some really good tips. In the morning, try applying a topical steroid to your flares as it's directed by your physician. Apply a layer of moisturizer to your arms, legs, and other eczema-prone areas. In the evening, think about those cool YouTube videos that you might go through. Morning routine, evening routine. Shower with lukewarm water, non-lathering, unscented liquid cleanser. Again, those do work. Pat yourself dry. You don't want to rub yourself aggressively. Apply topical steroids to rashes as directed. Apply a layer of moisturizer to your arms or legs or other eczema-prone areas. Or you can take an antihistamine 20 minutes before bed if directed, but no later than 11 p.m. because it can give you something that's known as the antihistamine hangover, so you want to be able to avoid that. Okay, so some quick questions for Dr. Leo for teens. What are your options?
I think really the same ones we've talked about, you know, that we consider adults and even the littlest kids. We want to think about the good topical regimen, gentle cleansing, good moisturization, and then for those more moderate and severe patients who are having trouble, we now have the option of that dupilumab medicine, that injectable. And I do have a lot of teens who are doing quite well on it, which is nice.
Okay. And we're running close to time just because this is such an important topic and we could probably talk about this all day, but all really useful information here. My eczema is getting better. Can I stop treatment? Now, eczema is controllable, but not curable. although it can get better with time. I can attest to that, both my sister and I. And if your eczema is getting better, your treatment is working. If you want to stop treatment, talk to your doctor, and there may always be another treatment that makes things a bit easier for you. So just make sure that you keep that in mind. And that applies not just to teens, but to everyone. Okay, so here's a checklist to figure out if your treatment might be working. I've referred before to the More Than Skin Deep collab. We found that 89% of people felt that there was limited effectiveness for the available treatments that they have. So this is a really big deal in terms of people being able to find what works for them, and also to look more into researching what works for people. This checklist goes through: is your skin less itchy? Are you sleeping better? That's probably one of the biggest ones. Look out for individual symptoms. Are those changing? Do you feel more confident about your appearance? And overall, how satisfied are you with your treatment? From a scale of very satisfied to we need to try something else. So those are things to work. Where can you find support? This is so key, especially in talking about some of the trouble that teens go through and having a good support group. AAFA has a wonderful online community that you can check out. If you want to join, you can go to aafa.org/community, or you can go to aafa.org/join. It's a safe and secure online support group for people with asthma, allergies, and skin conditions like eczema. You can learn from others with similar experiences. There's a lot of good exchange there. We have open forums that are really helpful. You can get and provide support to others. Share your story. That's another thing that's so important, and so grateful that Kylie is able to be here to do this for us as well. And you can participate in research and advocacy, because that really needs to continue to help find the best treatments for people and the best resources for people as well. Another thing that you can do is you can check out the National Eczema Association. That's another good resource. They're a really good peer group of ours, and we would recommend that as well. Okay. Oops. So a few more questions, if we can squeeze them in for Dr. Leo. Do we have time?
Yes, I'm going to do one question and then we will wrap up just a minute or so over. But I think a good question is, what do you recommend for parents of young children with eczema? I'm concerned for our health due to lack of sleep. And they actually wanted Kylie to take this one. Kylie, what are your thoughts on the littlest ones?
Yeah, so the littlest one. So for me, I obviously had eczema when I was little, so I went through it. And I also have a nephew that had eczema really bad when he was little. So some things that were the best were to cover. So like moisturize the areas that have the eczema, like after, oatmeal bath or things like that, like soak, moisturize, and then cover. That's very important. It's hard to tell your littles to just don't itch. Like that's very hard for them to understand. Like don't scratch, because they're like, well, it itches. I want to scratch it. Like I remember doing that. Like I'm not just going to let it itch. So cover those areas, something damp, something dry, cover those areas best you can. And just be honest and open with them and explaining. That's very helpful too. Don't get irritated with them. If they are itching, just try to have that patience. And, as far as the sleep goes, just try different things at nighttime to help soothe that skin so that they can fall asleep and get some quality hours in.
Perfect. Beautiful. Thank you so much. So thank you all so much for joining us. And again, Kafi and Kylie, thank you guys for providing us with this incredibly informative discussion. Thank you to our audience for joining us for the special patient education program. I'd also like to thank the Asthma and Allergy Foundation of America for their partnership, which we really couldn't have done this without. Support for this program was provided by an educational grant from Sanofi Genzyme and Regeneron Pharmaceuticals. Please remember to complete the questions at the end of the program to help reinforce some of the topics we covered today. You can also download all the slides from today's presentation. You can find this in the event resource section located under the video box. This program will be available on demand on MedLive. Once again, my name is Dr. Peter Leo, and thank you for joining us.